It's another day with your fertility specialist. On behalf of Alps Hospitals, I welcome you all to another exciting episode of A Day with Your Fertility Specialist. Yeah, it's Friday, and we'll be talking about life experience like we do most Fridays. We're here to talk about people's experience through this fertility journey pathway and how they've achieved success. So we're able to encourage someone out there that is losing hope, that is giving up, that no matter how difficult your situation may be, there's definitely hope for you as long as you are in the land of the living. So as we get started, feel free to call up someone, invite someone, send a message to someone, share this link with someone. Drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them appropriately. And today, to tread this path of life experiences of people, we have Dr. Deborah Olubi. It's good to have you with us. Yeah, Dr. Deborah.
Thank you, Ruth. Always a pleasure to be here. Good afternoon, viewers and
Oh,
listeners.
yeah. So, dear viewers, for someone watching for the first time, you might not know about Dr. Debbie, but I will just tell you a little about her. Dr. Debbie is a family physician. She's a fertility specialist, an IVF specialist, a very good one at that. And she single handedly heads the IVF department of Almighty Alps Hospitals. Wow. So, yeah, we have Dr. Deborah with us today, and she'll be giving us some charts into what our experiences are as this person tells her story, what our experiences are as a fertility specialist, as an IVF specialist, both at Alps hospitals and wherever it is that she might have experienced this fertility journey with people, how their rights are, how it goes with them, how it goes through the whole process, and how they have to deal with various clients. So I know someone is excited as we get started once again. Drop your thoughts, your comments, your questions in the comment section. I remain your host, Ruth Ogogo. Please sit back and enjoy the show. Dr. Deborah,
Yeah.
so we have a very, should I call it a lengthy read from one of the clients at your hospital. I think she had sent in some of her experience in the journey of fertility.
Okay.
And then I think she's also encouraging people. So I will just go straight and read and then we'll talk
Okay.
in between.
All right.
So she said her partner and her had been trying to conceive spontaneously for about 5 years without success. Like I can imagine. Oh,
Five
wow.
years.
Five
What a
years.
wait.
5 years is not like five
No,
days.
it's
Like
not.
even 1 year feels like 10 years. And then having
Exactly.
to wait for
Yes.
5 years.
5 years.
I can imagine for every time she thinks she's pregnant and then she sees her
It's a
period the
period.
following
The
month, like
tears will come.
I can
Wailing
imagine.
starts.
Yeah. Oh, yeah. So she said she had done various fertility checks and they said she and her husband were fine. Sometimes I wonder
Fine.
if
Yeah.
everything is fine and they've been trying for 5 years. I wonder the kind of fertility check that they really do.
Yeah, but
So,
sometimes everything could be fine.
mm,
And there's something we call unexplained infertility. You check, you do all the test examination, and you can't really pinpoint what the challenge could be or the cause could be. But then there's always something new to try. So even when you've checked and you've allowed them some time to try, 5 years is too long to have
or
kept
were they
trying.
going to the wrong place?
that
Because,
that could be another contributory factor. Were they going to the wrong place? We don't know the exact checks that were done. Some people might just be doing the barest minimum of checks, maybe just doing a scan or just checking the sperm. They're not doing hormonal assays. They're not doing other more sophisticated tests that tell you about fertility potential of the ovaries and so on. So
Yeah.
it depends on the test they're doing.
Oh,
Yes.
wow. So for 5 years, they, according to her, she said they had done various fertility checks. Yeah, we were, since she didn't review all of that in this
Yes.
lengthy read, but it means they had tried various places. But that's another thing. It's good to go to a good
Right
place
place.
where they
Yes.
have good experience and they are versatile. They are able to
Exactly. That's
explore
just it.
all means
Yes.
to make sure they are able to pinpoint what the exact reason
Cause could be.
would
Yeah,
be.
so those checks will be within the limits of what those facilities had.
Yeah,
So when
okay.
you've done all the tests they have and
Mm,
they're normal, they tell you they can't find any reason. But there are other tests that could be done that might not have been done. And then
oh,
we don't encourage anyone to keep trying for 5 years. Once you've tried for, like we said, a woman greater than 35 years of age, after you've tried for 6 months and pregnancy is not coming, a woman that is less than that, you've tried for a year and pregnancy is not coming spontaneously, you should think of an assisted method of
okay.
conception.
Mm.
Yes, you shouldn't wait for that number of years.
Wow. Yeah, so you hope you're noting that, dear viewers, if you've been trying and it's not forthcoming, you don't just sit back and do tests. You should go to a good
Yes.
fertility clinic where you're able to get proper attention. And if you need an assisted reproduction technique,
You
it's
get it
actually
done.
done for
Yes.
you. Instead of just sitting back and hoping and doing tests here and there,
And
and
then
then solutions are not
other
preferred.
issues will even set in,
Start
other
build.
medical problems and complications, issues will set in, especially for a woman, even for the man. Sperm that was very good before, with age, it starts to deteriorate. A
Wow.
woman that was fine, the womb, uterus was fine, fibroids could develop with age,
Hmm.
so other things could, come and complicate issues.
So she said that, okay, she said at some point, so maybe somehow they got to somewhere that gave them a different view. At
Okay.
some point, they discovered fibroids, but they told her it wasn't significant to affect her conception.
Okay.
So what's your opinion to people that have fibroids and they feel, okay, sometimes women do a lot of comparison. I have a
Yes.
friend that has fibroid and she has given birth to 3 children
Yeah.
and the fibroid did not stop her. What's your opinion to
Yeah.
this with
So
fibroid conception?
Yeah, so a woman with fibroids might still conceive spontaneously. So the issue with fibroids could actually impact on fertility, but the issues will be how many are the fibroids, what are their sizes, where are they located. We have different kinds of fibroids. We have fibroids that grow into the uterine cavity,
Okay.
into the place that pregnancy is supposed to stay and the baby is
Mm,
supposed to develop. We call it submucous fibroids. That
okay.
kind of fibroid could really impact on fertility. It
Mm,
could lead to failure of implantation, prevent the embryos from implanting. And
okay.
even when embryos implant, it could put the woman at a risk of miscarriages. Some people with
Mm,
recurrent miscarriages is because of fibroids located in that location in the uterus. Because fibroids could also block the fallopian tubes. So they prevent, transport the egg, a fertilized egg, getting implanted into the uterine cavity, or even the sperm moving to fertilize the eggs. So,
mm,
and then we have other kinds of, we can have fibroids that grow in the muscle parts of the uterus,
okay.
which we call an intramural fibroid.
Okay.
Yes, so depending on the size of this kind of fibroid, it could, if it's quite big, it could distort the uterine cavity. So that will
Mm,
also make, implantation pregnancy difficult.
difficult.
Yes, even
Wow.
when pregnancy occurs, it could lead to, because when it's so big, it will constrict and distort the space, the cavity that the
Mm,
baby is supposed to grow in. So it could
okay.
also lead to issues, even when the woman gets pregnant, will lead
Mm,
to issues with the pregnancy.
okay.
And that kind of fibroid, when it's big, it's drawing blood supply to itself, blood supply
Mm,
that should have been used to nourish the endometrium, from where the placenta will eventually form,
yeah.
it diverts blood supply to itself, and that will lead to a differential line,
Mm,
making fertility, difficult. So
yeah.
those kind of they just and they are sometimes hostile to pregnancy happening. So you
Mm,
can see that depending on the kind of fiber and the size.
yes.
Yes, even a fibroid that's in the muscle and maybe located posteriorly could even block the pathway for the baby to come out. So
Wow.
even when the fibroid and baby coexist, that kind of woman might need a cesarean section to deliver her baby. So
Baby.
fibroids can impact on fertility in so many ways. Yeah, fibroids, and they are able to conceive spontaneously, but a lot of issues, can interplay. It
Associate,
depends on the
yes.
size, the numbers, where are they located, what kind of fibroids. So you can't really compare yourself
With other
with another
people.
person. You just need to be properly evaluated.
Violated.
Yes,
Oh
yes.
yeah. So she said that then they had told her it wasn't significant to affect her conception. So they kept on with the struggle until she was referred to ALPS by her friend who had triplets from IVF. Oh, wow. So she said eventually, when they got to ALPS, it was discovered that, okay, other discoveries were made.
Okay.
Amongst them,
Okay.
we are part of it. And then they also mentioned that her husband's sperm count was low
Low.
and
Okay.
it had very poor morphology too with the
That will
sperm.
really impact. Yes.
So, so she said that she was counseled to have a myomectomy and that's having to undergo a surgery. Yeah, she was really scared, but that gave her hope for a fresh start.
This is for
She-
something different now.
Yeah, something
From everything is fine. We've not detected multiple uterine fibroids
fibroids.
requiring a surgery. So
Mm.
you can imagine the sharp, gap between the two evaluations she had.
So that makes
Yes.
me want to ask, when does fibroid surgery, what she mentioned as myomectomy, when does
Yes.
it become necessary, or when would you cancel fibroid
Fibroid surgery.
surgery, either
Yes.
open or the other way that you could call it?
Hysteroscopically.
Yeah,
Yes. So the
exactly.
hysteroscopic fibroid surgery will be if the fibroids are mainly submucous.
Okay.
Submucous is the kind of fibroid that grows into the endometrium, the uterine
Okay.
lining. So
Mm.
you can access that through the uterine cavity. So
Okay.
by the time a woman has multiple fibroids, that their
Mm.
sizes, you're getting to fibroids that are about 4 centimeters in
Mm.
size.
Wow.
Yes, AP diameter, and there are multiple, or even fibroids located in very delicate areas, like fibroids just under the lining of the uterus, because that
Mm.
would distort the uterine lining.
Yes.
Posterior fibroids that could obstruct the pathway of the baby to come out. Those kind of fibroids would usually require a surgery, which is the myomectomy. But if
Mm.
they are just tiny, tiny, what we call seedlings, 2 centimeter, less than that, less than 1 centimeter, might be ignored if they are not in sensitive location, especially just under the endometrium.
So aside fertility, let's even assume someone has
Yes.
fibroid and they are not looking at the fertility
Fertility.
angle.
Yes.
I think women generally, when they hear surgery or fibroid, they
Everybody
are really
scared.
terrified,
Yeah.
and some of them feel they just want to live with it. And I've seen some people
No, if
that
it's some
they are carrying
symptomatic,
fibroids and they
hampering your
look
life.
pregnant.
Yes,
So
it
when would you
hampers their life.
counsel?
Yes.
Just to enlighten the
Fibroid
public.
brings about a lot of symptoms. You have people having very heavy menstrual flows,
Hmm.
prolonged of pain. Some people really have
I've
severe
even
pain.
heard someone that she bleeds to the point that they have to transfuse
Fuse
her
her. Can you
because of
imagine? How
fibroid.
do you live with that? That fibroid
Wow.
needs to come out. Yes. So when
Hmm.
the fibroid is symptomatic, you're bleeding heavily, you're having a lot of pain, causing other, if it's so large, it's compressing other organs in the
Organs.
abdominal cavity, pelvic
Hmm.
cavity,
Yeah.
causing symptoms, symptoms due to the large size. No, that kind of fibroid should come out. Yes. When it's symptomatic, that kind of fibroid should come out. Yes.
Because I've even heard some people that have had miscarriages,
Yeah,
and
recurring
maybe they've been
miscarriages
trying that. I feel the fibroid can coexist with my
with the
baby, and
baby.
they keep
Yes.
having
If it's called
recurrent miscarriage.
miscarriages.
Mm.
Yes, that kind of fibroid should come out. Yes.
Okay. Okay. So, dear viewers, we for someone watching, even if fertility is not a goal, she has also
Your
let us
well-being.
know. Yes, for your
Yes.
well-being.
Yes.
Once it's
Your
what's
quality of life.
compromising
To increase your
exactly,
quality of life.
please
Yes.
you shouldn't say no to a fibroid surgery when it becomes necessary aside conception
Exception. Yes.
related purposes, please. Okay. So she said she mentioned your name in this. She said, so Dr. Debbie recommended IVF after her surgery due to the male factor, which is her sperm.
Yeah.
She said though she was nervous, but she decided to give it a trial because they were determined to grow their family. So she said there were definitely multiple challenges. Maybe now let me list one of the challenges and maybe I'll ask you. She said physically the hormone injections and procedure were intense and sometimes uncomfortable. So how do clients really, how should they manage the whole discomfort that comes with
Yeah.
these
So
prolonged
I think they should just,
injections?
yeah, it's not easy getting multiple injections. Nobody likes pain. It's not easy, but you should just have a positive attitude. It's towards an end. It's not as if the injections are going to be forever. You know why you're undergoing the injection is towards an end. Achieving your fertility dream, your conception dream, having your baby. So when you just have a positive attitude about it, it helps. Yes, the injections could have some side effects. Not everybody, experiences all most of the side. A lot of people take it and they don't have side effects, but I think that positive attitude really helps. When you have a positive attitude that this is going to end in me carrying my baby, be that positive. Yes, it helps you
Yeah.
to go through it. And then the cause for infertility can be multiple. It might not just be
Mm.
one thing. We were thinking it's just fibroids, and
Yes.
then
Her
discovered the
husband's
husband's
sperm.
sperm, the count is low and the morphology is not so good. So infertility is not just, sometimes some couples want to blame one partner. It could be
Mm.
multiple factors contributing to the
Yes.
infertility. Yes. So for example, somebody might have fibroids, not getting pregnant. Sometimes the fibroids might not even be in locations where you think it could hamper fertility.
Yeah.
But after evaluating and you're not really finding any reason, you could say, oh, these fibroids, let them come out. Maybe because fibroid can create an environment, a negative, hostile environment to
Environment.
implantation, to
Mm.
a pregnancy, a baby staying, and so on. So
Yeah.
sometimes the things are not clear cut. They're not like black and white.
Yeah.
Yeah, sometimes they're not black and white.
Mm.
You just do whatever you feel could improve the chance of a pregnancy happening. So like in this case they were thinking it's fibroids, low sperm count was, but because of the kind of fibroids she had to have a myomectomy. And
Yeah.
then let's say the sperm count was fine, we would have said okay. But
They
for
could
them
go
to have, yeah,
ahead.
they could go ahead to try for
Yes.
spontaneous
Mm.
conception, yes. But because of the low sperm count, so IVF was needed in this case.
Recommended. Yeah.
Yes.
So for someone watching, the fact that you have a fibroid surgery doesn't mean you
You
automatically should
have
have
you
an
need
IVF.
exactly,
So
yes.
if other
You
conditions
just
are,
out,
are fine and
yes.
favorable, your doctor will definitely counsel you to
Yes.
try. And then maybe
Yes.
if should it be pregnancy is still not
No,
forthcoming, then
yes.
they
Then
could
we can.
offer
Yes.
other means of assisted reproduction just to see that you're able to achieve your fertility dreams. Okay, and then she also said, but the emotional toll was even harder. Hmm. Waiting for results, dealing with uncertainty, and managing the anxiety of whether or not it would work. And so she said, well, when they were about to try the first IVF, I think so in this case, I think the first one failed. So
Oh,
she said she insisted on using her eggs because
yes.
she felt like how would she just be open to using donor
Donor
egg, I
eggs.
mean, and
A
all.
lot of people
So
want to try.
she was
Yeah.
counseled.
Yes.
And so she said after her first cycle failed, she
Yes.
felt crushed.
Oh, I can
But
imagine.
I can imagine, yeah, it's
Yeah,
sad.
it's
And
sad. Yes.
sometimes nobody would, no, none of a physician would just want to
Our own eggs
yeah.
first. Yes.
So in her own case, so after the first cycle, well, I think in her case, so she said I felt crushed, but I knew I had to stay strong and keep trying. So this is
That's the
someone that
spirit.
still had a positive
Yeah, that's
spirit.
the spirit to
Yeah.
have.
So
Yes, it
she still
helps.
didn't give up even after a first failure. Yeah. So I was also going to ask, what are some of the side effects from these hormonal injections that they are on? Because I know sometimes you might have to give you give counsel to your clients on what to
Yes.
expect while on
Yes.
this injection
Yes.
so that they don't feel weird when
When
they are
they
having all
experience it, then when they have
exactly.
that knowledge, when it happens, they are
Yes.
better
So
able
what
to
are some of
manage
the
it.
side effects that are common
Okay.
with these hormonal medications that
They
they are
have.
on?
Okay,
Yes.
so some of the things they could experience: mood swings. They could become more irritable. You notice you're a
Mm.
bit more short tempered. You
Oh
get angry
wow.
easily.
Hmm.
Hot flushes. You know, slight pain at the site of the injections.
Injection.
That
Wow.
also it's
Mm.
possible. Yes, maybe some bloating. People
Okay.
experience different things.
Different
Yeah,
things.
so hormones can really wage a battle with your body, but a lot of
Mm.
women are able to tolerate it,
Well.
and very few actually complain about anything.
Anything. Wow.
Yes,
Okay.
yes.
So this is just to prepare for someone watching
Mm.
for the first time, or you're thinking of how to go about IVF. She's just giving us, so it's not something scary.
It's not. It's not.
It's something that you can manage.
Exactly.
It's something that you can still go through and be happy and not
Yes.
just be all down like the whole world is on you.
You,
And
yes.
yeah,
It's good to
it's
have a
some
positive attitude. Yeah.
altitude.
Know that others have gone. That's why we share these testimonials and testimonies. So you know that other people too, you're not alone in this battle. There are
Yeah.
people going through, walking the same path, going through the same journey with you.
Yeah.
So that you know you're not alone. And people have gone through it successfully. You can too.
Yeah.
Yeah.
Okay. So she said her support system played. She said my support system played a huge role. She said her partner, that's her husband, was incredible, always there to lift her up when she felt defeated. She said, according to her, she said she also joined a support group for individuals going through, whatever it is that gives you solace, or
Whatever
whatever just
helps
makes
you.
you happy, or
Okay.
just
Yeah, do
helps
it.
you to push or find
True.
reasons to push.
Yes.
So in
Just
her own case now, she said she joined a support
support
group
group.
for
And then, but you see
individuals.
some women who want to be hidden. They
No,
want to hide
exactly.
it. They don't
Yeah.
want anybody to know. So whatever works for you, it's good.
So she
Yes.
said she also joined a support group for individuals going through IVF, and hearing their stories of persistence and eventual success gave her hope. So it means she was able to hear some of this, just like now we are doing this testimonial.
Yes.
So also let people know that yeah, there are many people that would have gone through IVF if failed, because IVF is not guaranteed
Yes,
anywhere in the
it's not.
world.
It's not.
So,
Success rate
but
is
then
not 100%.
what matters is your hope and your attitude towards it,
Attitude, a
and not
positive
giving.
attitude really
So yeah,
helps.
exactly. So she said after her first cycle failed, her doctor, that was Yupo at Alps Hospital now, she said our doctor suggested some adjustments to the treatment protocol and also suggested a donor backup.
Okay.
So I think in this case, probably they wanted to still try in another way
Yes,
to,
stimulate our ovaries in another way to see if we will get more eggs, more better quality eggs from
yeah.
her.
And
Yes.
then she said, so they started their second cycle feeling cautiously optimistic. Yeah, this is someone that has failed, but she'll
Before
still optimistic because sometimes people fail, and then even when they are trying, there's still this fear of what if.
that
Yeah,
cloud of failure is just around them and over them.
I
Yes.
was also going to ask, how do you put deal with these clients when they have failures? Like, how are they able to manage themselves? Because I know it's something that will hit you as the doctor too as well.
Yeah,
When
definitely. It hits us. We,
since
we get involved in this journey. We go this journey with them. So when failure happens, we are affected too. Maybe not to the same extent as the client. So we just encourage them. Everybody handles failure in different ways.
yeah.
People grieve in different ways. Just to encourage them and support them as much as we can through the process. Yes.
Okay, so dear viewer, so in her own case, well, she had all the support she needed, so they were still optimistic,
Yeah.
and so she said the 2 week wait, 2 weeks wait after
Must
the
wait.
embryo transfer. They usually say it's the longest
The
wait.
weight of your life. Not an
So she
easy
said
weight.
after the embryo transfer was nerve wracking. She was like, she said, but when they got the call saying the test was positive. Wow, it was the happiest moment
I
of
can
their
imagine. I
lives.
can
She
imagine.
said that was when they felt all the effort was worth it. Of course, when you have a positive result, you
Yeah,
know
you
that all
forget
you
all the
went through.
pain, you forget the
Yeah.
waiting, the discomfort, you just forget everything.
And there are some. I just this is me just thinking. Are there some things that push you feel after embryo transfer? Because I'm sure you would have had some experience with your
Yeah,
clients.
yeah,
They
people
ask you,
calling you, I'm not feeling anything. You
yeah.
shouldn't
So
feel
maybe you should
anything.
tell them some more. Is
Huh?
there something they should expect while they are
No,
waiting for pregnancy
we're not
tests?
expecting you to feel anything. We're happy when you don't even feel anything. Those that feel pain, those that have bleeding, we're not happy. So when you don't feel anything, we're happy. You shouldn't feel anything. Yes. Some people are like, I'm
Okay.
not feeling anything.
And there are some that
Some
say
that
they
feel
feel
something. Yeah,
pregnant and then it turns
exactly.
out
Yeah, but
negative, and you're
the
like,
hormones are still in the so the way you react to the hormones are different. Yeah. So some people still feel the same. They have breast fullness. I'm feeling lightheaded. I feel like nauseated. I feel
mm.
whatever you feel is fine. Anything, whether you feel something or you don't feel anything, all is all good.
Yeah, and
It's
I can
all good.
imagine. So those people that claim they don't feel anything, and then the test turns out positive. It
Positive.
feels like, are
Is
you for real? And I wasn't feeling anything.
anything. And
Oh
you see a
wow,
lot of people that feel a lot of symptoms, and sometimes the test turns out negative.
negative.
Now,
Wow,
like wondering, what have I been feeling?
feeling
Yeah.
exactly. Wow. So she said it was surreal. I remember looking into my baby's eyes
Hmm.
for the first time and just feeling this overwhelming sense of love and gratitude. Wow. She said all the postoperative follow up, sleepless nights suddenly faded away.
Way.
all the hoping and
I
everything.
think
By the
has
time
gone
you're seeing
through.
your baby, exactly,
Yeah,
you
she has
feel
achieved her dream,
consoled.
her goal.
Yes,
Yes.
yes. So she said it was the most magical moment of her life. And she was like, I wish I had known how important it is to manage expectations. IVF isn't a guaranteed success. This is even this is not a health practitioner
It's,
now.
yeah,
This
from
is a
personal
client now
experience,
that is giving
advice from
advice now
personal
to people. She's like,
experiences. We've had.
IVF isn't a guaranteed
Yeah,
success, and it's essential to go into it with an open mind.
yeah,
Oh wow,
very,
yeah.
very, very
And
true.
willingness to adapt.
Very
She
true.
said, I am beyond thrilled to share that I am now holding my miracle
Mm.
baby in my arms. Oh wow. It wasn't an easy journey, but it was absolutely worth it. And so she said, to everyone out there battling fibroids and
Yeah,
fertility issues, do not give up. Healing is very possible and still possible.
yeah.
Wow. Thank you so much, ma'am, for sharing. Yeah, for the sake of confidentiality, we didn't
Privacy.
mention her name. For
Yeah,
privacy, we didn't mention her name.
yeah,
But we really appreciate you for sharing out your testimony. And like we would say, for those of us that still want to, because we've had more comments coming from the comment section where we had to
people
say,
saying they
how
want to
do I share
share
my
my
testimony?
testimony.
You could chat up the number that's being displayed on the screen. You could send us a private chat on our social media handles. So we guide you on how you could share your testimonies, and so that yes, we can also assure you that if you want some privacies, that could be maintained. And if you're okay with us sharing your name, we also do not mind,
Mind doing
as
that, yeah.
that makes, as long as you're able to pass the message that our dear viewers would gain from
Yeah.
and get hope from. So yes, Dr. Debbie, what's well with this whole testimony of this man, what would be your counsel to our dear viewers
Yeah.
with
So
regards to now in our own case they had both sperm issue and they had
the fibroids.
fibroid issues? Yeah, so what would be your counsel on a general ground now with regards to
Yeah,
fertility,
so like
conception?
she counseled that they should be open-minded. You
Mm.
know, a lot of people come with what they feel should be done. They, like she said, you need to manage your expectations. People come with
Mm.
different expectations. Some of these expectations are not scientifically correct. Yeah, so imagine a woman that's
Mm.
50 years old coming with the expectation that she will still use
Use
her
our
own eggs.
eggs.
This is not
Mm.
scientifically correct, yes. So they should be open-minded, manage their expectation, be open to the counsel they are given by their fertility specialist.
Mm.
Thank God she was open to the fibroid surgery. A lot of clients that we see, we counsel for fibroid surgery. A lot
And
of
the
people don't.
decline.
Like you said, people are scared, they're afraid. A lot of people are not open to it. You let them know the implications of these fibroids on the treatment course they
Yeah.
are undertaking. They're
Mm.
still not open to it. So people being open-minded, open to advice and the counsel they are given by their fertility specialists really help, because whatever counsel you're given is to increase your chance of success, is to increase your likelihood of you achieving your goal at the end of the day. So I think that's one of the things. Clients need to be open-minded and open to the counsel they're giving.
So, dear viewers, like Dr. Deborah has said, keep an open mind
Yeah,
and do not have so much high expectations
yeah.
such that it clouds your judgments and you're not able to come to terms with the counsel
The
that
realities on
your
ground,
fertility
yes.
specialist
Yeah,
gives you, or you're not able to accept reality when it hits
yes.
you. And then so because the main goal is to achieve your fertility dream, and any counsel that would help you achieve that fast, age is ticking.
Age is
And the earlier
ticking.
you're able to get this, why waste so much time to come to reality when you can easily achieve your fertility dreams early, much earlier, if you had actually kept an
Yes.
open mind? Well, some people they'll say until they feel before their eye
I
they
okay.
clear.
Yeah. Some people
So, but
must just
they
try
still
what they
just
have
want
in
to
mind
try. They
first.
sometimes they'll say they just
Yes.
want to get to the point of them saying that okay, they've
I
tried their
all
best,
best
they didn't just go
exactly.
for the easy route.
Yeah,
Well,
exactly. Some
everybody
say that.
has their should I say their opinion to life and whatever
Yeah, and then
notions they have to
whatever
life.
expectation you have should be managed within the context of your own realities, in terms of maybe time you have available,
Mm.
finances,
Mm.
your age, other realities. You manage whatever expectations you have within your own realities. You shouldn't follow another person's reality. Somebody that has all the resources can say, okay, I want to try, I want to try, I want to try. But you that
Yes.
your resources are really limited, you should
Mm,
go for the best counsel you're
at
giving
that
that will lead
point.
to a shorter time to you achieving your goals.
Goals.
Yes.
So, dear viewers, this is just to raise or spark up the rim of light for someone. Yeah, you might be giving up. You might be thinking you might not be able to achieve all you want to achieve within a period of time, or you've set goals between so time to so time. I want to be done giving birth, and they don't seem to be forthcoming. However, it's good that you seek help early. It's good that while you're trying, while you're exploring all means, please seek help from a very good fertility clinic like the Alps hospitals, like the IVF team. Yeah, so we at this junction, we also like to say a very big thank you to the Alps IVF team and Alps as a whole. I mean, we've been seeing a lot of the testimonies people are bringing, and it takes a lot of expertise to be able to get to where you are at Alps Hospital. So on this note, we would love to say well done to Alps team, to the IVF team, all people that comprise of this IVF team. You guys are doing really well, and we really hope that it gets better by the day. And we hope that you make more of the clients out there, more of our viewers watching right there, right out there. We hope that they are able to get their dreams someday. So thank you, Alps team. Thank you, IVF team, and everyone that makes it a success. Because I know it's a
It's a
teamwork. It's
teamwork,
not
yeah.
one person that makes it happen. It's not one person that calls the shots alone. So, dear viewers, at this point, love to say a very big thank you for joining this chat today. Thank you, dear viewers. I see you all. Thank you, Jerry, for joining. Thank you, Dixon, for joining. Like I know some people that are very, very
Always
regular.
our regular, yeah,
On the yeah,
yeah,
Justina
clients.
or Nubi, I see
Always
you.
Justina, Madam Justina. Hello, how's our baby boy?
Thank you so much. It's really good to have you guys join all the time. I
Yeah,
mean, all our regular
yeah,
regular followers. We
yeah.
we we extend our love to you, and we say you guys are doing a lot. You guys are doing great, and we do not take this really. I must say once again, like I said earlier on, if you're trying to share your testimony or share your experience with us at Ops Hospital, just to enlighten someone, just to make someone know that there's hope out there, just to encourage someone that is giving up already, please chat us up on our private number being displayed on the screen, on our WhatsApp number, I beg your pardon, being displayed on the screen, or you could private chat us on any of our handles, and we'll definitely give you the opportunity and guide you on how to share your testimony so we're able to read it out and help people get as much as you have also been able to access from the Alps team. Continue to stay tuned, continue to like our post, dear viewers. We really appreciate you all for joining this evening. Okay, so I can see a question coming up. So this is someone saying, oh, Eloho Celestine, she said house hospital advised her to remove fibroid. Now she's a mother.
Yeah.
Oh, wow. So she said, thank you, Alps team. Oh, Dr. Deborah, you seem to know this patient
Yes,
the way
I
you are
know.
laughing. Oh, wow.
I remember. I know her very well.
Okay, so Ella, thank you so much for that comment. Yeah, so that was so you see, this is someone that also had fibroid, and she was counseled to take it out. I believe she had also tried in various means and it wasn't forthcoming. And then she was able to get good counsel from Alps hospitals, and now she has gone past the fibroid surgery. She has had a
Carrying her
successful
baby boy.
treatment, and she has her baby. Wow! Congratulations once again, Mrs. Eloho. So thank you so much, Javier. Please keep dropping your comments, keep dropping your questions. If we're not able to attend to them now, we'll definitely attend to them appropriately. Once again, okay, Justina. So yeah, I know we mentioned Justina.
Yeah.
She said, "Yes, Alps team, you are great." Oh wow, a lot of accolades to Alps team. Thank you so much, dear viewers, for engaging us this evening. Once again, thank you for joining this evening. Thank you for always staying tuned. We look forward to having a very pleasant time with you as always in our next episode. Have a lovely evening. Bye.